prevent overdoses. Do you know, probably like a month ago, I didn't do this article, but I was reading how they were trying to figure out a way, listen to this, to train homeless people on the streets to use Narcan so that they can help in saving some of these OD victims of drug overdose. You know what that is, ladies and gentlemen? That's desperation. That is pure desperation coming from a people that clearly know they are dying. You know, yesterday I was on the phone with my favorite uncle down in Florida, and he and I were on the phone for like an hour and a half. And he's been really keeping up with a lot of things going on. You know, he's watching Trump and all this investigation and everything go down. And we got on the subject of a few things. And he was talking about how bad this drug addiction is among the Caucasoids down there in Florida. And he told me how he's been out several times and seen these white junkies on the streets down there in Florida, panhandling and just looking all zombified walking around. He's seen it. And he said, these drugs are taking them out fast. I said, yes, it really is. And then we got on the subject of us being 13% of the population. Now, he's 74 years old, ladies and gentlemen. And he was telling me, he said they were saying that when I was in elementary school. He's 74 years old. And he said he remembers being told we were 13% of the population back when he was in elementary school. And he told me, and he may not be off the mark. He said he really believes that we are at 100 million in America, not 40. He said, whatever they're telling us, double or triple that number. And that's where we are. But he said, I really truly believe that the black population in America is at 100 million in this country. He said, we definitely ain't at no 40 million and 13% of the population. He said, that is impossible because we never had any type of decline. And he said, and even with the cops killing us and it's not putting a dent in our population. We're still growing. More of us are being born than dying. We're able to replace our dying population, where the Caucasoids, they can't do it. They haven't been able to do it probably for a few decades. They got to come out with it now because, see, they can't hide their junkies, and they can't hide the fact that we're going out in public and we're not seeing too many of them with babies anymore. So, as it becomes more obvious, their lying tongues are going to have to eventually confess. But it was an interesting conversation. Like I said, we were on the phone probably for a good hour and a half, just chopping it up. And it was so much fun being on the phone with him. All right, let me get into this story. And I want you to take notice to the name of this doctor. Dr. Philip Coffin. Oh, how appropriate. Compares naloxone, the drug used to reverse the effects of opioid overdoses, to seatbelts. Seatbelts can prevent drivers and passengers from dying in a car crash, but seatbelts can't prevent the crashes themselves. Naloxone can prevent people who overdose on opioid drugs from dying, but can't prevent overdoses in the first place. In fact, if you've survived an overdose, your chances of overdosing again in the next year are around 25%. I disagree with that, Coffin, and here's why. There has been too many instances where Narcan had to be given to the same drug addict several times a week. That's why, if you remember, there was a city councilman, and I believe it was Ohio, that was trying to limit the emergency calls to drug addicts because they were calling so often, and many times it was the same drug addict. And he wanted to cut the Narcan off and came under a lot of backlash for that. So I disagree with what he just said, but let's move on. Director of Substance Abuse Use Research at the San Francisco Department of Health. And your chances of dying from a subsequent overdose are substantial, suggests a Massachusetts study presented Monday in Washington, D.C. at the American College of Emergency Physicians annual meeting. Opioid overdose deaths nearly doubled in that state between 2012 and 2014 and 2014 and 2016. Study co-author Dr. Scott Weiner said at a press conference, "Our group was perplexed by this, considering that naloxone is now fairly ubiquitous," said Weiner, an assistant professor of emergency medicine at Harvard Medical School and director of B-Corps, the Opioid Response and Education Program at Bingham and Women's Hospital in Boston. Now that's a long title there, Weiner. Okay, Eviso. Auto injection device pre-filled with naloxone and Narcan, a pre-filled naloxone nasal spray. Make it easy for family members, caregivers, or emergency responders to administer the drug. Weiner and his co-authors examined information from the linked statewide data sets for patients who had received naloxone at least once from emergency medical services from July 1st, 2013 through December 31st, 2015. About 400 people a month. And this is in Massachusetts that he's talking about. It's quite a bit for our small state, Weiner said. So there you go. They got Narcan available, and the death toll keeps climbing, ladies and gentlemen. What does that tell you? It tells me their 6,000 years are up, and the Most High is going to get their asses the hell out of here, dead or alive. He doesn't care. So they won't willingly step down, so he'll just kill them off. Please tell me what you think, ladies and gentlemen. Please leave your comment, and don't forget to click on that notification bell. Peace, family.